Okay, so this is the types of joint movements, and um, these movements, we'll start here with abduction and adduction. So abduction, abduction, and adduction, adduction, are both um, referring to moving away from the midline or toward the midline. So abduction, abduction, is when, say, you move your leg away from the midline. And adduction is when you move it back towards the midline. Think of adduction, adduction, as adding it back to the body. Dorsiflexion and plantarflexion. Dorsiflexion is pointing your toe up. Plantarflexion is pointing your toe down. And then flexion, extension, and hyperextension. Flexion is increasing the angle between the bones. So right now, that leg and that thigh and leg have a 92-degree angle, and when we extend it, we increase the angle. So when that leg is fully extended here, the angle is 180. So we went from 92 to 180. So basically, extension, you increase the angle between the bones. Flexion, you decrease the angle. Okay. Here's flexion. So flexion at the wrist is you're decreasing the angle between the bones. So it goes from 180 to about 100. And an extension would be going back to that neutral. Hyperextension is when you go past neutral. So hyperextension is going past where you would be in anatomical position. Other types, you have rotation. Rotation is when the body part rotates around an axis, but it's the length of the body part rotates around the axis. So this one is, this body part is just, your hand is just turning back and forth. Circumduction, though, is when you have a fixed point and you're rotating around that fixed point. So this arm is rotating around a fixed point where it's rotating along the axis here. Supination is turning your palm up. Pronation is turning your palm down. So anatomical position, you're supinated. Think of how would you carry soup? You'd have to be in supination to carry that. Okay, eversion and inversion refers to the foot. Inversion is when you turn the sole of your foot in toward you. So say you thought you had gum stuck to the bottom of your shoe, you would do inversion to look at it. Eversion is when you turn it out. Protraction and retraction. Protraction is when you stick your jaw out, your chin, and then retraction is when you pull it back in. Elevation and depression. Elevation, you raise your shoulders. Depression, you lower your shoulders. This is a great website if you want to look at different joints, and it has different animations other than your APR. So this is a great website to go to if you want to look at stuff. Lifespan changes. Over the course of your life, your joints become more stiff. You get less elasticity in your synovial joints, less synovial fluid, decreased flexibility throughout your joints. So that's it. Lifespan changes. These are never positive messages. It's not like things get a lot better as we get older. Clinical application. Sprains are damages to cartilage, ligaments, or tendons that happen in a joint. So sprains are different than strain. A strain happens over a muscle, but sprains are cartilage, ligaments, and tendons. So you do something to damage those. Bursitis, we've already talked about, inflammation of the bursa over a joint. Arthritis, there's different types of arthritis. So you have, but arthritis is inflamed, swollen, painful joints. There's different reasons for arthritis, I should say. So rheumatoid arthritis is an autoimmune disorder. And it's where your joints actually become ossified because of your immune system attacking them. So with rheumatoid arthritis, you may have to have the joint replaced. Osteoarthritis is an overuse type of arthritis. There are some hereditary causes, but generally it's just an overuse. And it is also the most common type of arthritis. Especially as our population extends their lifespan, osteoarthritis becomes more prevalent. Gout is when you get crystals formed in your joint cavity, and gout is often associated with excessive alcohol use. There are other reasons, but that's just a common one. Okay, so now everything that we did in this lecture up to this point are is what is on the lecture test.